Over the past decade, smartphones have radically changed many aspects of our daily lives, from banking to shopping to entertainment. The next generation of healthcare is now upon us. With innovative digital technologies, cloud computing, QR codes, the medicalized smartphone, tablet, laptop, and computer is starting to improve every aspect of healthcare. And the end result? Patients will take center stage for the first time with improved and faster healthcare. With the smartphone revolution, an increasingly powerful new set of tools, from diagnosing ear infections, glucose readings, and tracking heart rhythms, to QR quick response codes to help speed up the pace of healthcare and give accurate, up-to-date patient medical history to paramedics and doctors and nurses in hospitals, which is so important, especially in times of emergency. The MedID Wristband identifies your needs, your medications, and your medical conditions. It identifies you instantly on the paramedic or doctor's smartphone right from your wristband. Medical staff are also trained to identify any medical information made available to them when they arrive at the scene, usually identified by the universal Star of Life icon, the symbol of healthcare. This symbol lets first responders know, much to their relief, that more medical information about the patient in distress is at hand, and that helps them immeasurably. It helps in their decision-making process for your well-being. One of the most difficult and concerning tasks a paramedic has is to identify the patient's medical needs. One study, when surveyed, found that 35% of emergency medical technicians on scene have made errors. Any emergency situation is not the time for doctors or paramedics to be guessing about a patient's medical history, allergies, or current medications. A strong consensus among community and medical workers is that a lack of up-to-date medical information in emergency to EMT is not in the best interest of the patient's health care. Paramedics do a great job with what they're given, there is no doubt about that, along with the stress and challenges that come with the job. How can they improve and do a more proficient job during a patient's emergency care? One way most paramedics will certainly agree is by simply wearing a medical wristband, because you'll be providing them with the tools they need to quickly learn about your health needs, to begin proper treatment on scene and en route to the hospital, and to be able to forward up-to-date information to the team of doctors and nurses that will take over your healthcare needs in your emergency center upon arrival. The MedID band represents your voice in the event of unconsciousness or if you're confused or not able to communicate, to alert the paramedic to important facts, like whether or not you are a diabetic, if you have any food, insect, or drug allergies, or if you have an allergy to insulin or a serious medical condition that requires quick action. The MedID wristband is also the patient's communicator if they are lost or in a confused state of dementia or Alzheimer's. It can also let paramedics know if a patient is on blood thinners or other medications that may interact with treatment, other serious problems such as COPD or asthma, or a transmittable disease. These are serious concerns for paramedics and need to be addressed at the scene of the emergency. Providing your medical profile in an emergency situation could mean the difference between a short and long-term hospital stay, and it can even be life-saving.
When an emergency arises, we expect and rely on a quick response time. Our lives may depend on it. Emergency first responders do their part diligently. They're trained to get to us in time of need as quickly and safely as possible, to assess our medical condition, to provide proper treatment, and to stabilize us on site for transport to hospital as quickly and safely as possible. From the ambulance to the emergency ward, there is a great system of highly qualified healthcare teams and equipment in place to help provide you with the best possible health care. But with all the equipment and healthcare skills of physicians and nurses on duty to help you, if you can't provide them with your current medical history and list of medications, or if staff is perhaps held back by trying to acquire your record of medical history and medications through your family doctor, you may find your much-needed treatment delayed or the need of urgency overlooked. More and more people and communities are taking advantage of this innovative smart ID development designed to improve quicker and safer healthcare, which in turn also makes things a lot easier and safer for paramedics and doctors who treat you. Many first responders have even gone as far as making the point that not wearing a Star of Life medical identification band or bracelet can create a significant risk and complication to those experiencing a serious emergency crisis. Since we all well expect and rely on a quick response by emergency responders, isn't it time emergency responders should be able to expect and rely on us to provide them with instant access to our medical profiles? After all, it's for our own safety and for those we care about most. Wouldn't it give you and your family and friends more peace of mind to know the first responder can access an up-to-date, accurate medical profile to render safe and proper care in an emergency for you or a loved one? Well, it's as easy as wearing a quick response MedID Wristband. That would complete the circle to better health care in emergencies and may even save your life. Why not help them help you? Our mission is to provide a progressive healthcare result from the get-go with the quickest, most accurate method for accessing a patient's comprehensive medical history. Here is how the paramedic accesses your medical profile. 1. The paramedic simply opens their app icon on their smartphone or tablet and scans the QR code on your medical wristband or visits MedID.ca on their browser. 2. A page comes up asking for the PIN number. 3. The PIN is revealed by undoing the wristband and pulling out the PIN card inside the band's sleeve. It's hidden under the band's flap for privacy purposes. Instructions for first responders to locate the PIN are engraved beside the QR code of the wristband tag. The first responder keys in the PIN. A sample medical profile has been created for your review. PIN number B8250. Then, a quick tap provides them with instant access to the medical profile in case of emergency. This process takes only seconds, and now paramedics, fire, rescue, doctors, or any other healthcare professional can learn about the patient's current medical status. They can first see a photo to quickly identify the patient. Then, scroll down to obtain valuable medical information so that they can better assess the patient's condition and history. An emergency where an ambulance is required because of a child's illness or of a spouse, a parent, or an aging grandparent can have a traumatic effect on the whole family. That's one reason why we have adopted the philosophy of providing paramedics with a healthcare approach for safe evaluation by means of a MedID quick response medical wristband to maximize the possibilities of patient well-being. A MedID wristband will not only give comfort to the patient, knowing their medical history is there for paramedics to see and apply, but it can also decrease the anxiety of paramedics, positively affecting their ability to provide proper care and treatment. Wear it for your safety and to take the guesswork out of the equation for paramedics. Wear it for your peace of mind and for the peace of mind of your family.